the issue at hand is institutional, is also personal, because I have been a leader for the last 10 years in the healthcare profession, starting as a leader of medical students at my university in Imbarra, a national leader. I started the Federation for Uganda Medical Association myself, the umbrella body for all medical interns in the country. And this issue started in 2016. Government proposed to pay only those who did medicine on government merit. And then those of you whose parents are so caring to look for either loan or affording money, then government wanted to criminalize that literally by saying your parents or guardian must pay you to come and work. Then for those on government merit, you were to be, government was to confiscate your license for about 3 years. You can't work anywhere. Government is holding at ransom, something we rejected. And to us, we are saying no. And a bold, big, fat elephant we're like, no. Why? One, these are qualified young people. Two, an attack on them is an attack on an entire profession. Is an attack on the quality of care they are going to give to the patient. Yet as doctors, we did swear to protect life. There is no one who will protect another man's life when his or her own is in danger. So you don't expect them to go to these government hospitals and offer a service. So we are saying every man should receive recognition for the service they offer. And of course we are bothered by the deliberate blackmail by government. Blackmailing qualified doctors as students. That's a lie. Let me ask a question. Who has a workplace that is institutionalized, that doesn't have supervisors? President Museveni is the supervisor of ministers. The speaker supervises the MPs. So does it mean, does supervision mean studentship? No. Even when you get a new job, they orient you. They don't orient you because you don't have the qualification, because maybe you don't have the skills. No. This is a new environment. You have to be oriented. And internship doesn't mean that actually these younger people are learning for any academic qualification. It's a global standard of practice in medicine and surgery. That when you finally qualify through these skills, first you work alongside an experienced person. Experience is got on job. No one gains experience by being in class, by being instructed. People gain experience by working. So these people are here to give a service. But then, when you factor in the Ugandan context, where government health facilities staffing is at 20 to 30%, and that means where you need 10 doctors, you have 2 or 3 maximum at all levels, whether general doctor, whether special, and for specialists is worse. Where you need 10 specialists, you have 1 in the government facilities. The figures I'm quoting are Ministry of Health data. Okay? It's not an NGO research. These are Ministry of Health statistics. So these young people, government, first of all, has been exploiting them. Even the 2.5 they were giving them was not enough. Even the 1M was not enough. Now, government wants to further harass, exploit, do forced labor. This is taking us back to slave trade. Why? Government has refused to recruit doctors, nurses, pharmacists to fill these spaces, and has gone for the cheap labor of 1M, 2.5M, and also doesn't want to facilitate that cheap labor. The people who are pushing this, the Twine, the Honorable Bariomonsi, Acheng, Jane Ruth, for those two, at least Acheng and Bariomonsi, when they were intern, they were given accommodation, 2 rooms per doctor. They were given free food. They were airlifted to their internship sites. They were given a leave, a paid leave. On top, they were paid a salary that is equal to the starting doctor of that time who was already in public service. But on top of that, despite those benefits, Barry almost led a strike of interns that he wanted an increment. And the money was increased the following year twice. We moved from 90,000, which doctors, starting doctors were earning then, to 180,000. Acheng, senior colleagues tell us, did strike because she just missed meat for a week in their food rations. Okay? You remember those things when we were in high school? They take long to bring eggs, and you get annoyed. That's the level of entitlement she had. And reportedly, she was even transferred from Lira because she was causing Kavuyo and brought to Mlago, where probably they were meat. Meat was. Now, such kind of colleagues don't have the moral authority to even talk about scrapping pay. They are saying, government doesn't money. I want to be clear to Ugandans. This government has the money. And a lot of this money. It is just being spent. The money is just being used to do lavish stuff. Give some to attack, to invest in his or her own private enterprise. Spend over 300 billion. 300 billion. When you look at Attorney General's report and other statistics that are related to government, government spends over 300 billion on paying for medical services of government officials, MPs, ministers, abroad. You get it? In Kenya here, across. Germany, US. Why don't they come to Mlago? Why don't they come to Mbarara Regional Faro? Why don't they go to Chiriandongo General Hospital? Because they have deliberately made the services there unbearable. These young people you see work under very harsh conditions. When I was president of medical interns in 2018, I had 2 cases of female colleagues who were assaulted physically when they are working in the night to go to those ghetto places where they were renting. That time we were paid only 700,000. 700. And people had to look for accommodation in very far places. So they are saying the numbers of interns have increased. That's also a lie. When you do the math, in fact, ministry, in this new policy they want to use to scrap or pay, they say Uganda needs at least more 20,000 medical students, nursing students, some of us into the schools. So they are recommending actually more universities training medicals are opened. Okay? That's their very own recommendation in that policy. What does that mean? They are fighting themselves because they are also realizing the numbers are not the problem. Uganda needs the numbers. Our doctor-patient ratio is very, very miserable. So the numbers are needed. What government must do is to prioritize healthcare. Know that actually healthy population will be productive and the economy will grow. Because the research has shown where you invest 1,000 shilling in healthcare, you get back tenfold. That means you get 10,000 because you are keeping people healthy. These younger people, I can tell you, are very depressed. They are making their future look very bright. And this is not acceptable. Uganda is not the one which started paying interns. Kenya, they are paid. In fact, an intern in Kenya earns more money than a starting government doctor in Uganda. That's the truth. 7 million. Here, gross pay of a doctor, starting doctor is 5M. take home is around 3 point something. Okay? A government doctor. In Kenya, the intern earns twice the Ugandan doctor. Is Kenya very far from here? Rwanda is paying. Tanzania is paying. Even South Sudan is paying. Now, who are we Ugandan to say for us, we want to specialize in doing the wrong? This government seems to be specializing in doing the opposite of the will of the people. So, they should, one, stop. Because we are not going to stop to call them out any day, out. And by the way, let me put this disclaimer. Don't threaten us. Because we are used to the threats. Just listen to us. Do what is right. We shall even begin clapping for you. As long as you don't do that, we're going to call you out. Because there have been a narrative that is running around that actually, I saw Semakade saying that, you see, these interns, after we're paying them, they have to go and work elsewhere. I want to break that down and demystify it. An intern doctor gives more than 500% to government than what government gives them. How? When I was an intern, I did my internship in Kawempe, Mulago, and Chirudu. I went to Kawempe for 1 month. I was deployed at Kawempe for 1 month. I did 50 cesarean sections. That every day I was doing 1 or 2 scissors on average. A cesarean section at Kawempe in a private wing is 2.5 million. 2.5 million. That's just doing the scissor and keeping the mother for just 3 days. So let us calculate 50 scissors. That is okulongo somulade, mama. Times 2.5. How much money is that? How much money? You calculate for me actually. How much money is that the intern has generated to government? Because that money is taken by government. Then, I don't even remember how many mothers came in when they have lost their pregnancies, and the remains inside there are going to cause them their uteruses to rot. Those ones were like 5 to 10 every day, and we were evacuating them. Then when you talk about those normal deliveries, the ones who delivered normally, you cannot count. I then worked at Mulago. Casualty, night, blood, you don't have gloves. The patients we resuscitated. The surgeries we did are way more costly financially. They add a lot to the economy than the just 11M that government paid me for an entire year. So there is nothing that interns are taking away. It is government chiyambayo okusasula ba intern doctors. Nibasetolinga, nibakola. Kati bakimanye ffe ba supervisors, abakola mugana malwaliro. We are not going to push these younger people to work the way they have been working if they are not paid. Mwana ajja kujja akole sawa bili agende aye kyagenda okola ki okulya. Abalwadde bajja kubeera waawo. They will not be worked on. Because government anyway is not going to recruit. He's not going to recruit the doctors. The consultants, by their nature and job description, they are not going to come and clerk every patient. A consultant sees patients who are complicated, not starting patients. Okay? So government should not think that consultants are going to see the patients. It is the intern doctors to see the patients. So financially, intern doctor, government chiyamba yo kumusasula. Then, my message to our young people. For almost 10 years, we have engaged, we have resisted wrong. They should also stand up and use all mechanisms available to ensure this government will hear whether it wants or not. So, social media is here. Every intern should wake up, should not sleep, should wake up to compose a short message and share it with the public. They should have solidarity. This country and the world we are in doesn't give you what you deserve, what you fight for. So when you sit there and thinking, Mirembe Joel, I see some of you have been calling me, you are our CDF commander. Please, temusudia. Mesudie. Mbasaba. Muzukuke. We work together and engage government. And you don't abuse anyone. You don't need to be vulgar. Be professional and ethical. But be very serious on what you are talking about. If it is a match to parliament, let us organize it. These RDCs and the medical schools, wherever I are, let me give you a short story of what happened in 2016. 2016, I was a third-year medical student, but also I was a leader, national leader of medical students. And they brought these policies. The first interpretation I got is that, hey, after they have not paid these people, that means when I finally leave school, they will also not pay me. Yet I was in third year, so I was also on ward, seeing what these interns over that time were going through. I mobilized with my colleagues, we mobilized all medical schools, and they resisted. You see, you people are saying the doctors are on strike. Most of them were us, because this was our issue. So the medical students currently and the pre-interns have to take this issue personal. The parents who want to educate scientists, this is their issue. And the general public, why? It is you who are broke who come to those hospitals. When you don't find the intern doctor, my friend, you will be in trouble. When you find him, but landlord is knocking, he can't afford to pay, don't be to wash his clinical coats, is walking to work, coming while and to Yansaza too, mentally that doctor is not stable. He will be more dangerous to you. But then you have no option. You will have to go to that dangerous doctor. So let us join hands. We call upon the civil society. We call upon government officials. Mwedeko, you are the ones owning private schools. Mwedeko, put these things right. Government needs a maximum of 50 billion, maximum, per year to pay well 2,000 interns. And this was approved 2021. We went to Parliament. Parliamentary Committee on Health sat and discussed this matter, made a report, and the report was adopted by the Parliament of Uganda, 2019. And the report's recommendation was clear that the intern doctor should be paid the same amount of money as the starting public service doctor who is on permanent contract. Why? They have the same qualification. The difference is experience. The other one gets some allowances that the intern doctor was not going to get. When later we went to Genome 7 in a meeting, he said they didn't have enough money, but let them start, because that time we were in a collective bargaining agreement as Uganda Medical Association with the government on the welfare of doctors. Let them start at 50%. That's how intern doctors started to be paid 2.5 million. He further recommended that the intern nurse at a degree level, the intern pharmacist at degree level, the intern dental surgeon at degree level, also they should be paid 50% of their respective. The nurses then were paid around 3 point something. So the nurses started receiving 1.5, and the pharmacists and the dental surgeon receive the same pay as us, because they are also medical doctors. So actually, in this advocacy, we want the status quo to return to that level. We don't want their one aim that Nabanja just woke up from her dream and said, "Tubawe kakade kam." That was the decision of the Prime Minister. Tubawe kakade kam. The policy they brought, we want to tell government, hold it. Why? You did not consult any responsible stakeholders. Maybe you consulted yourself in your boardrooms and your bedrooms, such that we can review that policy properly, realign it properly, and we can now pass it. In fact, I think we should escalate this issue. It should be an act now, because the policies, they keep violating them even when they are written. Let us look at probably having an act for the Uganda Medical Society that will also regulate internship.
Yeah.
For God and my country, Sabasaja Kabaka Wangale, service with the honor.